in the land is affected. So we talk about, begin to have a fossil burning of fuel that affect the health. One of these is the lungs of people. We begin to see people having high rates of lung diseases. So it's the fact that since there is an issue of water pollution, now if you go through the drainage of the state, you find out that many drainage are sealed off. Many drainage are sealed off due to the fact that there's no proper waste disposal, and this begins to bring about waterlogged areas where insects like mosquitoes, butterfly, other and this bring about diseases like cholera, diseases like also started. That if all these are not taken care of, if the atmosphere, the land, and the water are not properly taken care of, deforestation is not properly taken care of, the increase in our gaseous exchange mean burnings of things, burning of fuel in cars, and all this. The effect of it is the fact that people and the land will be sick. So this is why Katsina State is having this, should I call it, issue on the front burner: climate change, environmental pollution, and then its adverse effect on health. And I wish that everyone hearing the sound of my voice, of course, will join the host of this meeting and everyone here to push in the agenda of SDGs 2030, that everything that pertains to SDGs, talking about health, talking about climate change, talking about zero hunger and the rest, come to a fruitful end. Thank you very much for having me. Thank you very much.
All right, thank you very much. That was wonderful from the Elijah climate change advocate. So I can see online our speaker is online. Join us. Related from parents, children, and also other things that in the Nigeria, their practices, their cultures, their beliefs that we are. So she will be exposing and increasing a lot of things as to how and where we can meet up with the health challenges in Katsina State and measure through which we can meet these challenges. Also with me, I have SDGs, fellow, who is one of the panelists, and our fellow is also a panelist. So you are all welcome. This time, I will give this space to the speaker so that she take us through everything she has for us today. And it's time to ask questions. You can ask questions, any question you have. It's more of a discussion. After her presentation, we're going to engage a lot so that we can have a foundation of everything we need to know about our health and how do we control our diseases from escalating our environment. So you are welcome, Mato Siama Bengawa. The floor is now yours. Thank you for joining us.
Okay. Good evening, everyone. I hope you can all hear me.
Yes, can you?
Okay. The network is quite bad today, but thank you for having me. So let me start by sharing my screen so that you can get on with the presentation. It says here that host disabled participant screen sharing. So I think you have to remove that restriction before I can share my screen.
Can I go? Yeah, I think you can share it.
Okay. Can you all see this?
Yes, you can see it.
Okay. All right then. Okay. So let's start, right? Okay. So my name is Siama Sulaiman Bindawa, and today we are going to be discussing on goal number 3 of the SDG goals, which is good health and well-being. So as we all know, there are 17 goals of the SDG. Each one is very, very important. And today we are going to talk about the goal number 3. This is our table of contents for today. I'm going to briefly introduce the topic. Then we are going to talk about the importance or significance of it. And then we are going to briefly look at the targets that the goal is trying to achieve. And then we are going to discuss the problems and the obstacles that we are being faced. And then maybe come up with a few solutions. And finally, we'll be done. Okay, so to start with, good health and well-being. It simply means to ensure healthy lives and promote well-being for all ages. I don't know how to. Okay. So, like I mentioned earlier, this SDG is like a number of goals that are needed to be achieved by the year 2030. And for goal number 3, it simply means to ensure healthy lives and promote well-being for all people, regardless of the age and in all parts of the world. It also seeks to reduce the global burden of disease and improve the health of populations, and also promote mental and physical well-being. So this is just briefly like saying what is good health and well-being stands for. So good health is one of the most essential things in life that needs to be achieved regardless of gender, regardless of age or whatever. Okay. So why is this goal number 3 important? Why do we need to discuss on it? So here I have a number of things that shows us why good health and well-being is important. So the first thing is that health and well-being are fundamental human rights. What this means is that good health and well-being are essential human rights, and therefore access to quality healthcare and the right to live a healthy life are basic human needs that every individual deserves and that every individual needs. Improved health will lead to an economic growth. Of course, because, and this is actually straightforward, when people are healthy, they are better able to contribute to the community and also to the economy. Sorry. Improved health will lead to reduced healthcare costs. This will in turn increase productivity and also a better quality of life, which in turn leads to economic growth. So this is what we are saying is that once people are healthy, the money that they will need to spend on their health will reduce a lot. And this will make them to be more productive at their aspects of life, at their work, at their home front and all that. And this will increase the economic growth. Then promoting mental health. Mental health is an essential component of overall health and well-being. Promoting mental health can improve the quality of life for individuals and communities. And also by reducing healthcare costs and also improving the economic growth. Addressing health inequalities. So this SDG goal number 3 is very, very important because it will help us to address health inequalities. This health inequalities we are facing can be as a result of socio-economic status, as a result of your gender, and also geography, where you are from or where you're located. So therefore, addressing these inequalities is important for promoting social justice and ensuring that everyone has equal access to healthcare. SDG goal number 3 is interconnected with other SDG goals. So one way or the other, as I mentioned, we have 17 SDG goals. This goal number 3 is interconnected, one either directly or indirectly with each of these SDG goals. Because if you don't have health, then you can't do anything else. So you have to be healthy first before trying to go on with your lives. So this is just a summary of why this SDG goal number 3 is very important in our lives. So here we have a diagram of the SDG targets. So like I mentioned earlier, these are the targets that this goal number 3 is trying to achieve or is aiming to achieve by the year 2030. As you can see here in this diagram, we have 9 targets. So there are quite a lot, and we probably don't have time to go into details for each, but we can just look through it and understand it. For the target number 1, it says to reduce the global maternal mortality rate to less than 70 per 100,000 live births. So we have to improve our healthcare system in such a way that the number of women that die during childbirth or after childbirth should be at least less than 70 per 100,000 live births. Goal number 2 is to end all preventable deaths under the age of 5 years of age, because from birth until 5 years of age, this period is very, very critical for development, because this is where most of the deaths occur. The children are still growing, their immune system are not that strong. So any little disease they might end up dying from preventable causes that if things were not so, it would have been prevented. So we have the target number 3, end of the epidemics of AIDS, tuberculosis, malaria, and non-transmittable diseases like diabetes or hypertension. The target number 4 is to reduce premature mortality from non-communicable diseases and also to promote mental health. Goal number 5 is to strengthen prevention and treatment of substance abuse, which is very, very prevalent in our society right now. Like the rate at which people are becoming addicts is quite alarming and very scary actually. So we have target number 6 is to reduce deaths and injuries due to road traffic accidents. Target number 7 is to ensure universal access to sexual and reproductive healthcare services. And then final target is to achieve a universal health coverage. So like I said, this is all so brief. In case there is any of the targets that you want me to discuss, we can discuss that at the end of the presentation, inshallah. Let's move on. Okay. So these are the targets that the SDG, us as individuals would like to achieve by the year 2030. But you know how things are, and there might be some problems faced along the way, prevent us from achieving these targets or from achieving these goals. So let's discuss them briefly and see what they are. So the obstacles or the problems that can be faced and that can prevent us from achieving this SDG goal number 3 by the year 2030 is as follows. The number one most important thing in this, I think for me, is actually health workforce shortages. What this means is that health workforce shortages. So what this means is that there is actually a shortage of health workers in many parts of the world, particularly in low and middle income countries like Nigeria. This shortage can make it very difficult to provide adequate healthcare services to everyone who needs it, because the ratio of those who are sick to the ratio of those who are going to treat them is actually very, very low. For example, in this part of the world, Nigeria, and this part of the country, for example, in our state here in Katsina, you will see that the number of patients being here for treatment, plus the number of doctors and nurses there to treat them is very, very, how do I put it? It's very, very low. The ratio is very, very low. You will see a single doctor trying to attend to more than, like, in a day, to more than 500 patients all at once. They might not come at the same time, but then it's really, really not encouraging. So the second thing we have is inadequate health infrastructure. Inadequate health infrastructure, which includes medical facilities, equipment, and technology, can make it difficult to provide healthcare services, especially in rural and remote areas. So you will see a situation whereby we have patients that are sick, we have health personnel that are trying to do their job, but the things they need to do their job are not present. Sometimes this equipment, these medical facilities are very, very basic, that in common sense, it actually needs to be there. But then because of the world that we live in, we find that these things are short, they're not available, which make work difficult for the people that are trying to do their work, all at the expense of the patients. Then we have health disparities and inequalities. Health disparities or differences and inequalities based on maybe gender, socioeconomic status, and geography can make it difficult to achieve this goal number 3. These differences can result in differences in access to healthcare services and outcomes. So what I mean by this is that in some certain cases, there are some differences and inequalities that are seen in the healthcare field. These differences, like I mentioned, can start from your gender. The way males are treated sometimes are different from the way females are treated. You know how these things are. You might see a female, she's seriously sick and she needs medical attention, but someone will now come and say, this one, she's just faking it. Maybe she just don't want to go home and do her house chores. That's why she's faking sick. While if a man were to come with half of what this woman has, then he will be attended very quickly and efficiently. Because why? It's a gender inequality. And then the second inequality or disparity we're facing has to do with your social economic status. We see it everywhere. It's all around us. You will see a person being treated or being respected more based on his social economic status. So just because you're poor, you'll be subjected to mockery. Many injustices are done just because of your socioeconomic status. Then the fourth obstacles that is preventing us from achieving this SDG goal number 3 is limited funding. I think it's self-explanatory. Limited funding. Adequate funding is very necessary for SDG number 3, but many countries face limited resources for health. This can make it very, very difficult to invest in health systems, to invest in health infrastructures, and also in workforce development. Okay. Then we have limited access to essential medicines and vaccines. So all these obstacles I'm mentioning usually happen in our own part of the world. Because these things I'm mentioning, you won't find them in developed countries. They are way above that. They have moved on. But here we are still struggling with this kind of things. So limited access to essential medicines and vaccines. Many people around the world do not have access to essential medicines and vaccines due to factors such as high costs, limited availability, and inadequate supply chain management. You will see a person needs an essential medicine or an essential vaccine, but because of the price of these things, they can't afford them, so they'll have to let them go. Limited availability, they need them, they have the money for them, but you won't find them anywhere you go. For example, we have here, sometimes in the hospitals, we try to treat cancer patients and we prescribe drugs for them. But because of the limited availability, some of them have to go as far as Abuja, Lagos before they can buy these drugs. No matter how expensive they are, they will then buy these drugs and bring them back to us to treat them, which is very, very disheartening. And also, inadequate supply chain management. What this means is that from the high top, we have something called the supply chain management, right from the raw materials to making these products to distributing them and to selling them. So sometimes there's a glitch in the system and not everyone will have access to this kind of things. Then we have emergencies and disasters. Emergencies and disasters such as natural disasters like floods and the like, and also epidemics can Please, can you all hear me?
Yes, we can hear you.
I hope I'm not going too fast.
It's fine.
Okay. All right.
Thank you.
Emergencies and disasters. Emergencies and disasters such as natural disasters, conflicts, and epidemics can disrupt healthcare services and cause significant health challenges, particularly in vulnerable communities. So in vulnerable communities, for example, let me mention one of the most common disasters we're facing in this part of the country, which is flooding. So as we all know, the rainy season is on its way, and I'm very sure measures to counter flooding are not being put into place. So maybe by the time this rainfall comes, villages will be flooded, their homes will be flooded, their farms will be flooded, everywhere will be flooded, including hospitals. So you see, this will lead to like a setback in extending medical help to these people, because the hospitals that they have in this community are also not available. Then we have non-communicable diseases like diabetes or hypertension. This also provide major setbacks or drawbacks when it comes to achieving SDG goal number 3. And then the final problem that we have, I'm sure there are more, and by the end of this presentation, we're going to be discussing more of it. So the final thing we're facing right now is lack of data. So I don't know if I mentioned, but in these targets actually has to do with numbers. For example, target number 1, it says to reduce global maternal mortality to less than 70 per 100,000 live births. How do we know when we have 100,000 live births in the community? How can we count them? And how can we keep on monitoring that? We know that, okay, yes, maybe in the year 2012, we had, let's say 500 maternal deaths per 1,000 live births. Maybe in the year 2017, we had 100 maternal mortality per 1,000 live births, per 100,000 live births. We know these things by keeping up, by doing researches, by keeping data. So lack of data won't allow us to know whether we're making progress or not. And this means that we might just be doing things blindly without knowing whether we are moving forward or moving backward. So collection of data is very, very important for this. I hope it's clear for all.
Yes, it's clear.
Okay, thank you. So these are some of the obstacles that are preventing us, and I think if this keep going on, we might not likely achieve the targets we're aiming by the year 2030. So I think we have to get rid of these obstacles before we can achieve our goals, before we can achieve our target. How can we get rid of these obstacles, and what are the solutions that we can bring to get rid of these obstacles? So we are going to discuss them now. Okay, first and foremost, one of the most important things to do is to increase funding for health systems and services. Adequate funding for health systems and services is necessary to achieve SDG number 3. Governments should increase investment in health. Improving the education. Sorry? Sorry, I can't hear you. Did I go out? I go out? Hello.
Yes.
Can we proceed? All right, I'll take that as a yes. I'll take that as a yes. Okay. So the second solution is to strengthen the health workforce. Okay. So as I was saying, strengthening the health workforce. This means that, in a way, the government might strengthen the health workforce by sponsoring children to study health courses like being doctors, nurses, lab technicians, and the like. And in turn, when they're done, they come back to the state that sponsored them so that they can work under them. As for the issue of health personnel leaving, the government can provide incentives that will attract these health personnel and make them stay instead of going out and looking for greener pastures. Improve health education and awareness. Same thing. It's actually kind of the same thing. By improving the health education, providing incentives, sponsoring children for scholarships, and some of these issues might be improved. Then promoting gender equality and reduce health inequalities. If you can remember, I mentioned earlier that in the health system, there are a lot of inequalities, including gender, social and socio-economic inequalities. So by promoting gender equality, give, regardless of your gender, you're giving importance, whether male or female, whether a child, regardless, you are treated as equal in the health system, then I think a lot of problems will be solved. And also by reducing health inequalities. Also by increasing access to essential medicines and vaccines. Because like I mentioned, these things are somehow inaccessible to a lot of people. You see, we have a lot of essential medicines and vaccines that are not provided to the people who need them. Let's look at this picture. It says here, vaccinate your family. Vaccination results in an 80 drop, for example, yes. Vaccination results in an 80% drop in measles and deaths between the year 2000 and, between the year 2000 and the year 2017. So this is just an example. If proper precautions are taken, if essential medicines and vaccines are being provided to people who need them, we'll see a lot of differences. We'll see a lot of improvement being gotten in communities at large. For example, measles used to be, it's still one of the most deadliest diseases that kill children under the age of 5 years. But with proper vaccination, with availability of these vaccines, at least 80% has been dropped in just 17 years, which is a very big achievement. So if other things have been treated with importance like this, I think we'll go a very long way. Then the rest of the solutions is to address the social determinants of health. We have a lot of social determinants of health. Things like poverty will determine your health. Things like education, how educated you are, can determine your health. And also, for example, access to clean water and sanitation can have a significant impact on health outcomes. I think at the beginning of this presentation, and there was someone who, I can't remember the name, sorry, who was mentioning that there are a lot of environmental factors that contribute to health, and he's very, very right. Because if we want to improve our health, then we start from our communities, we start from our environment. If we are living in a dirty environment, then of course we won't be healthy. No clean drinking water, no environmental sanitation, then we'll forever be unhealthy. But once we start from ourselves, once we start from our environment, doing proper sanitation, sanitizing our homes, then we'll see a lot of improvement. So achieving most of these things will actually start from us and from our environment. Then the seventh thing is to promote responsible use of substances. Like I mentioned earlier, and one of the targets of SDG is to promote responsible use of substances, because as we are living right now, we have a lot of misuse of these drugs. We have a lot of drug addicts. So if we promote responsible use of substances, because actually most of these drugs that these youths are using to get high are actually very important drugs. They are essential drugs that are used in our day-to-day activities. But because they are being misused or being misdiagnosed, then this has promoted the problems we are facing now. So one of the solutions is to promote the responsible use of substances. Then strengthen health systems for early warning and risks. We can do this by maybe investing in disease surveillance, in outbreak response, and in emergency preparedness. So we don't have to wait until we are faced with a problem before trying to get the solution. Right now, we can start, building ourselves in case a problem occurs. For example, COVID-19, the way COVID-19 happened, almost everyone in the world, all the healthcare system was affected by it. Why? Because there was no preparedness for it. It just happened all of a sudden, and there were no things that were put in place to combat it. So by the time it came, it all caught us off guard. and we all suffered for it. So I think one of the major solutions we have to do is to strengthen the health systems for this kind of thing, so that when they happen, we know how to go about them. Then I'm going to say a brief conclusion of my presentation. Achieving this goal number 3 requires an approach that addresses the social, economic, and environmental determinants of health. And like I mentioned, we have social determinants of health. There are things that socially determines our health, economically determines our health, like funding from the government, and environmental determinants of health, like clean water and environmental sanitation. So therefore, by working together, we can ensure that everyone has access to quality healthcare and lives a healthy life. Thank you so much, everyone, for listening to my ramble. And I hope you have learned even a single thing from this. Your contributions are needed. If you have any questions or additions, you're most welcome.
Thank you, Dr. Siama. That was a great one. I really appreciate your benevolence coming to join us in this.
No, thank you for inviting me, actually.
Webinar today. Oh, thank you very much. So, like you said, I think we have a lot of things on our desk in Katsina State. You know, there are different practices in health, and how do we consider their
I'm sorry, I can't hear you clearly.
There is normal practices. People that are there. There are people that believe eating, they eat at any time. Other people have different kind of practice. Maybe they tell you water is nature, that disease doesn't kill Africa, and a lot of excuses like that. So those things we do that hamper our health. Now, can you highlight some of those things and how we can mitigate those things to improve the quality of our health?
Can you please repeat the last part?
Today,
I'm very sorry, but I think it's my network. I cannot hear what you are saying. Okay.
Hello?
Hi. Yes.
You can hear me, right?
Yes, I can hear you.
So I said, the things we do, if you go to the mechanic workshop, he feels normal to use the unwashed hand to eat. Yes. If you go to other places like that, you see some kind of things we do, we feel they are not bad, they are normal, but they are affecting our health. So yes. How do we identify those things, and what do we do to mitigate those things so it don't affect our health?
Okay, so I think if I can understand from what you're saying is that there are a lot of unhealthy practices that have been done in the community and that people consider normal, but in turn they are not. So how can we get rid of that, right?
Yes.
Yes, okay. So like you said, it starts, and these things are actually our own health start from us. So we have to learn how to take care of ourselves. We don't necessarily have to start being sick before we can think of in taking serious precautions from our health. So I think we can actually do that by creating awareness as individuals. Maybe you as yourself, when you see someone doing something that is not right, try to correct him. Try to make him understand that so and so of what you're doing is not right. This is the right thing to do it. And it's and maybe that one person that you told will go and tell another person, and before you know it, there will be an improvement. Also, we can do that, by creating awareness in social medias, in these radio stations and televisions and the like of that. It starts from, it might seem like it's not working, but with time and with persistence, we'll achieve our goals, inshallah. I did not hear a single thing you said.
Hello. Can you hear me now?
Yes, I can hear you.
So I said, we live in the age of technology now.
Yes.
And in this age of technology, what are the things that enable us to improve our well-being? It's not just going to hospital, taking drugs, taking injection. Are there any trends in technology that can help us improve our well-being?
In a way, yes, I think yes. Since we all have one way or the other, we all own something of use. We either have a laptop or a phone, and we have internet. So you can use that to do your own researches in your own little way. Maybe you've seen something and you're not quite sure what that thing is. Just a quick search on the internet can provide more information on what that thing is and what to do to prevent it. So you can use technology to improve your health.
Okay, that's great. So let's have question from the group. Now, our doctor is here. She's experienced. Anyone with a question, you can just raise your hand so that I will unmute you so you ask your question. If there's any question, you can just raise your hand, or you can use the chat box to ask your question. Is anybody raising hands?
Questions are welcome. Give me hard ones.
Okay. Actually, Doctor, our attendance is not.
Yes, I can see
actually what I expected. We actually wanted the entire community to join, and maybe for one thing or the other. Although I received some information that some people could not operate the Zoom, so they are using the live stream because it's being streamed live on YouTube. So those people on YouTube, I guess if you have a question, maybe we have a representative to check the YouTube. If there is a question, you can just drop it in the comment section.
I think there's a question here, right? It says,
no, someone just.
Yes.
He said, thank you. Thank you for using your experience. So, Khadija. Yes, Khadija. Khadija, you can unmute yourself and
So let me try answering the
Awal.
question by Awal Bello. He said that what role, in my own experience, what role does community engagement play in the success of innovative health initiatives? Community roles are very, very important in achieving the health that we need and the health that we want. Because let's say, for example, if a community were to set aside a day in a week, just a single day, maybe let's say a weekend, a Saturday and a Sunday, and they come together as a community to clean their own community, maybe to clear out the gutters, to sweep the areas, to clear out unwanted obstructions and all that. In a way, they are doing this to improve their own health, because when they clear out these gutters, their water health will improve, and this will generally lead to improve health. Their kids will take more clean water, and there will be less mosquitoes and reptiles and all of that, so which in turn will improve their health. So when communities come together, they can achieve more than if a single person were to come together. I hope.
Okay, think that's great. That's great. Is Khadija not unmuting? Khadija, you can unmute your mic. Awal Bello, you can unmute your mic. Oh, I guess the network is fluctuating. Khadija is offline. So Awal Bello, can we hear you?
And I think
I'm hearing you, sir. I can hear you.
Okay, so let's hear from you.
Hello, sir. Can you hear me?
Yes, let's hear from. Yes, I can hear you. Let's hear from you. Awal. Awal, you're in the noisy place. Can you move away, please? Hello. Can you hear me, please? Dr. Siama.
Yes, I can hear you. Sorry.
Okay.
I think
Awal is in a noisy place.
Everyone has left.
Yes, I think there are people watching on YouTube.
Okay.
I think about a few set of people are watching on YouTube.
Okay.
So I would like you to just brief us a little bit about the developments, when I mean achievement in the healthcare sector. How was it in the to be less in the next 5 years?
I think yes.
Hear that?
Can you repeat that, please?
So I would like to care, Sarah, in the nearest future.
Can you hear me right now?
Yes, I can hear you, Awal.
Okay. Firstly, let me start by showing our sincere gratitude for your outstanding presentation, Dr. Siama. We really appreciate.
Thank you so much.
So I've already asked my own question, but I don't know if I have any contribution to share.
Yes, please, you can.
Hello, can you hear me?
Yes, we can hear you.
Yes, we can hear you.
I think my network is not good. Let me change another place.
I think it's time for prayers. That's why everyone is leaving.
Hello,
Yes?
can you hear me, Miss Ma? Hello?
Yes, we can hear you.
Yeah,
Yep.
I think it is time for prayers. You see, we Muslim, we want to go for prayer. So, is there any time extension for the webinar, or we can conclude with
No, we
with
can
our
continue.
prayers?
We have about 30 minutes here.
So, I don't know.
We have about 30 minutes.
Okay. So now we are going to pray, and we'll join you again after we pray, inshallah.
Okay. So, Dr. Siama,
Yes?
I think so far so good. Thank you very much for joining the meeting. For the sake of those people that will come and watch the replay later,
Yes.
we want to say thank you. And the health facility I was talking about in Katsina State, you know, it was somehow before you became a medical doctor, and there is how it is currently, right?
Yes.
And there is how you think it will be in the future. So can you briefly tell us how it was and how it is, and how do you think it will be in the nearest future?
Okay. So regarding how it was, I actually don't have that much information about it because I wasn't in the system before, and considering that I didn't do my university here, I didn't visit the hospitals that quite often, so I didn't know how the health system was. However, when I became a medical doctor and I started practicing, to tell you, I was shocked. It's an understatement because it was not what I was expecting. It was so much, much, much worse than what I expected it to be. You know, the healthcare system was kind of crumbling in a way. We had, for example, when I did my health job, we kind of had the manpower, even though we weren't quite much, but we were enough. But the facilities that were needed for our work was zero, was non-existent. We really, really struggled because here we were young and fresh out of medical school, trying to make a difference in our own little way. But there were discouragements from every angle, from the hospitals, from the systems, from the patients sometimes. So it was quite discouraging, actually. I was disappointed in a way, but I'm happy that I got to experience that because it shaped me and I learned so much from it. So for the future, I think with the right leadership, and if major improvements are made, I think there's always room for improvement. I think we can always improve. We can be better than how we are now with the right leadership.
Okay, so this whole thing boils down to leadership. So we need also help us improve our health care. How do we improve our healthy communities through technology? How do we improve?
Sorry, I couldn't catch
Hello?
that. Yes.
I said the technology now. No, we live in the technology age, and a lot of healthcare workers are making different things around the hospital or healthcare facilities. I read an article recently about the effect of smartphone radiation on disease control. Now,
Sorry, on the effect of what? The effect of what?
effect of smartphone radiation.
Okay. Yes.
On disease control. And the author was talking about a particular emission that comes out from the phone that can easily impair the health of patients. And the advice the author gave was to hinder or discourage the usage of smartphone within the healthcare facilities, or it should be reduced to the barest minimum. So do you think technology in that sense has helped improve the lives and well-being of people, or that rather wasn't the situation?
I think in a way the article is right, even though I don't have that much information about how phone radiation affects our health and all that. But in my own little way, I'm very sure that there are some things that are not healthy when it comes to how much exposed we are to our devices. For example, the amount of this brightness that we get exposed to on a daily basis can be very, very harmful to us. It can affect our sight in a way, actually. And because we see a person from morning till dawn, he'll have a phone in his hands on the maximum brightness and very close to his face. So of course that's not healthy, and that can cause some major effects to his health. However, regarding the radiation that the phone emits, I actually don't have that much information in it. So maybe when I read more, I'll be able to answer that.
Okay, so thank you very much for your concern and your inputs.
Thank you too.
Anyone from the field participant, anyone with a question, please, can you just raise your hand?
I think they have all gone to pray.
Okay, yeah. So thank you, Dr. Siama. I am Otbe John, the representative for Katsina State SDG Advocacy Cohort 3, and we are happy to have you give us this enlightenment about how we can improve our health. And we also sincerely pray that next time we could call on you to enlighten us the more. So we are grateful and thank you for joining us in the webinar. I think with this, we can say goodbye.
All right.
Thank you very much.
Thank you so much for having me too, and for listening to my ramblings and for all the questions. I really appreciate it. Thank you, Mr. John Opie.
So if we want to link with you, how can we get your information? Are you on LinkedIn, Facebook, WhatsApp, Instagram? How do we link with you so we can learn from you personally?
Yes, I am on Instagram and no, I'm not on Facebook. I'm on Instagram. My WhatsApp is kind of private, but you find me on Instagram at Siam Bindawa.
Okay, Dr. Siam Bindawa on Facebook.
Yes.
Are you on
Sorry?
I think the network is a bit squaky. The network is a bit slow.
Yes, yes, true. All right then. Well, thank you for having me there.
Thank you too. So you do have a wonderful evening, and our advocates will contact you on Facebook, or if any other information is needed, we will appreciate your input. So we are going to contact you from time to time as much as we can. So thank you for joining us for the great enlightenment.
Have a good night.
Sure, thank you.
All right, bye-bye.